My name is Lauren Massey. I live in Vernal, Utah. We have our new baby Alex, who's 3.5 weeks. I'll never forget what the doctor said, and the look on his face. He told me, "I've never seen this before, and we're either going to need to lifeline him or maybe send him by ambulance. We don't really know what's going on and what we're going to do yet."
The x-ray came back and it did not look right. It wasn't something I recognized immediately what was going on, but knew enough to know that this was not a normal x-ray.
It was a Sunday morning, and I come in to do our huddle and our sign out with the neonatologist had been on. He had received a call from Uintah Basin in Roosevelt, Utah, and had dispatched a team that had gone by helicopter over for the baby. It was a 34-week gestational age baby, so about 6-week premature.
And so I called the neonatologist that was on, helping us cover, and he went down, out of Utah Valley, went down to radiology and looked at the film.
And it was obvious that this baby had air not only in the middle of the chest that had leaked out of the lung, but also in the sac that surrounds the heart, and that's called a pneumopericardium. That actually can become a medical emergency, and babies can die from that. And so I was concerned about that baby taking off in a helicopter, which causes the air to expand by about 30%, and the baby getting trouble in the air. So I talked to Lifeline and said, "I'm going to drive over." And they said, "Well, hold on. We have a helicopter and we have a pilot." And he said he didn't want you driving. He would fly you there so you could get there right away.
And he immediately put them at rest and said, I've done this at least 50 times, and talked to them, walked them through what would happen right there at the side of the warmer with the baby, and got their permission to go ahead, and had family in there, and family was at ease after he talked with them.
You could see Mom and Dad relax just a little bit, knowing that he was so good to walk them through everything that he was doing. He was very personable.
It wasn't, well, I'm smarter than you and I'm going to do my own thing. It really was a partnership.
In order to have that specialized care, if you live on the Wasatch Front, you just drive up to the hospital and get that done. But if you live in Roosevelt with a newborn, then we're 2.5 hours from any tertiary care facilities. And so arranging that situation with Intermountain was extremely advantageous to us and to our patients.
The wave of the future is telehealth, because we can't afford to take subspecialists and spread them throughout the community. So what happens is patients move in, they leave their home, they come in. We don't even know the total cost of that. Currently, we have the largest neonatal telehealth program in the United States, so that we can be present at the bedside, right at the radiant warmer. They can see us, we can see the baby, we can talk, we become part of the resuscitation team. When we make a commitment like that, we want to be there and we want to support them.
It's good to know that we've got someone that has our back and someone that's willing to work with us so well as they all do.
And at that moment, I was so grateful for someone who cared that much about my son, not his grandson, but to take the time to come out to rural Roosevelt to help my son, to make sure that he had the best care possible. It was very touching.
If my granddaughter was at Uintah Hospital, I would have driven there to take care of her. I wouldn't do anything less for anybody else's baby.
Thank you, thank you, thank you.